Every Thursday, we have the pleasure of having a doctor join us to answer new questions about COVID. Today, Dr. Ajay Kumar is with us. He is the Chief Medical Officer for Hartford Healthcare. Thank you so much for being with us.
My pleasure.
Here's one of the questions we get a lot. At what point, after a person is exposed to the COVID virus, is that person likely contagious? Does the virus have to be in the body incubating for a certain period of time?
Yeah, so generally the virus can be transmitted. The individual can be contagious for up to 14 days after the initial exposure. Usually, the period of significant contagiousness is in the first early 5 to 7 days, but it can extend up to 14 days. That's why we recommend 14 days of quarantine for anybody who's been exposed.
All right, and who also is eligible to donate plasma, which has been shown anecdotally to help some patients recover? For instance, would you disqualify someone who has recovered from COVID from donating plasma?
Well, so generally, there's certain requirement. Individual must have a known infection to the COVID, proven either by the testing, by the PCR, or some sort of antibody testing. 14-day period must be passed from the time the infection is resolved till asymptomatic period when individual is in the resolution phase. And after that, those individuals will qualify for plasma. There are some caveats there. There are especially we prefer the male plasma, the female plasma who never had a baby born and never had a baby, or somebody who actually had been pregnant in the past is HLA negative. So there are certain testing still required for some specialized population. Generally, most people who have recovered from COVID and 14-day period has passed will qualify for that. There are certain circumstances where I think the discussion with the primary care physician, the physicians would be helpful because certain condition will disqualify largely. It's the right thing to do. It's a wonderful therapy for our COVID patients, and most patients will qualify for that.
Okay, and as we look toward the fall, are we in any better position to battle COVID if we're unlucky enough to get the virus than the patients who had it early on?
Yeah, so I think it's a great question. So we're still learning, as you know, the science is still evolving on the COVID front. We've come a long way since early stages. Obviously, we have noticed that the therapies right now, we understand them better to a certain extent. We have remdesivir, we have tocilizumab, we are using dexamethasone. We have convalescent plasma, which we didn't have in the early Feb and March. So we are definitely better positioned than we were in March. And I'm hoping some of the therapeutic trials which are going on right now, by fall, we would have a better understanding and we would be in a much better position. The biggest hope we have is the vaccines, and the vaccines will provide a significant amount of protection, and our goal should be to reduce the disease burden in the community and the society. Now, that still will take some time,
right? But
we are definitely in a better position. Are we out and clear? We are not. There's no treatment we have found which completely treats it at the moment. There are a combination of things to reduce the mortality, duration,
right,
reduce the severity at the moment.
But no cure as we know right now. So Dr. Kumar, I know you're going to be back with us in our next half hour to answer some more questions. Thank you so much.
You're welcome.